What's your name? How are you? Regular partner. Sir. Hello, how are you?
ಅದು ಆಯ್ತಾ ನಿಮ್ಗೆ ಯಾವುದು ಸುಲಭ ಇಲ್ಲಿಯಾ?
Machine lock is like a master. It is send a request. More
inaugurates. Yeah, Naveen. Prasad. You first inaugurate it and then yes, Naveen.
Yeah, yeah.
Prasad.
So this, hello, madam. This is robotic system. Actually, this is the made by the Medtronic. We have multiple companies. We have installed with the Medtronic Hugo system. Basically, it has a four parts. It's like a console, and it is the tower or the generator, and is the arms. And so basically, yeah. So basically, the patient will, if you take this is the table, OT table, patient will be lying down with the laparoscopy ports, like minimal invasive small ports will be 3 or 4 ports depending on what is the requirement of the surgery, and it will be connected to the this robotic arms. So it can be used. We have 4 arms. We can use for three, minimum 3 required, or one more addition. So these arms will be connected to the tower, and tower will be connected back to the console. This is the console where the surgeon will be sitting and operating. So this is the hand controls. So this hand, finer hand movements will move these arms, the robotic arms within the tummy. So that we will give the command. It is not like robotic surgery. The robotic is not going to operate. The surgeon is going to operate with. So all knowledge, everything is the same. It is not like robotic is going to operate. The surgeon is the driver seat in the all the control. So and the assistant, we have need a bedside assistant, both with the sisters and one more assistant colleague. So he will be seeing through this monitor. Yeah. So the advantage, it is like the better vision. What we get in a normal laparoscopy, it is the 2D vision. So here, what is the how it is the anatomy is like a 3D vision. So we'll get a with the closer view, closer precision, like particularly benefit like a cancer surgery or organ preservation, where we want to preserve some nerves, preserve the main structures. That will be very beneficial. So that's why the recovery is very fast, because minimum handling of the tissues in the, unless in the open surgery we touch everything. In the robotic, what is needed, what we are going to touch, so that the recovery is very fast with that. Yeah. So
also, if I may add, uh, if you look at the history of surgery, initially we used to give large cuts. Then came laparoscopy, wherein we made small holes. And now here, it further helps surgeons by improving the range of movements. So it's more ergonomical. It gives you the comfort of sitting a little away and then having full range of movement, which probably is not possible with laparoscopic surgery. So in that sense, a lot of advantages, and we should thank our management for getting this. So
Yeah, we don't compromise on quality.
we know that, yeah.
yeah,
There are plenty of
many are there.
in the Manipal group itself. We have around 36, 70, and this Hugo is number one. And we might.
After take also.
Manipal is.
No, it's not there. We are actually looking out for acquiring. Manipal also, Bangalore, they don't have.
We have this robot. That robot we have around 10 or 12 now.
This, what about this?
This is,
Basically, these are different companies. Like now, this is like international brand. We have like recently come up with the Indian brands also, SSI, Merrill. So that's why the cost is a little bit constrained. Maybe as the government is pushing for the this thing, made in India trial, it will
this
come.
is
Yeah.
different because here we are an academic institute. We want assistant also to see what is happening.
Yes.
Which is not possible in the Da Vinci type of robot, which is only surgeon. Only surgeon can see and surgeon can. This is for
Training.
for academic
Training. So everybody can see the.
That's the advantage of this system.
Like hands-on experience, not just theory. Yes. Orthopedics. No, pass it, huh? He is Kiran Acharya, he is
Head of the department.
for orthopedics. Yeah.
laparoscopy surgeons.
Yeah.
So first, scissors, please. Yes, bani sir. Bani, bani.
Yeah.
So this is striker Mako. More details, Dr. Sharath will be presenting in the meeting.
This is again also is like a robot assisted surgery. It is not that a robot is going to do the surgery. This is a robotic arm. That's a saw. And here is the camera. Three main parts. One is the computer, camera, and the robotic arm. So we feed the CT scan of the knee into the better CT scan of the knee into the system, and it creates this, and it tells you how, what is the size you select, what is the thickness of the implant you select. Everything detailed is told in that, and we open the knee and then we map it, so that when mapping, the camera takes up the mapping. I'll show you a few slides, and that mapping will be correlated with the CT scan inside that, and then it creates an image. The data is transferred from the operation table to this, and that is the robotic arm which has got a saw. Now I have to hold the saw and cut it. But when I am cutting, if it is 1 degree this side, that side, saw will stop. Saw will stop. It can only cut in one direction, which the computer does. So the precision will be very good. Most of the job is done by the surgeon. This robot will assist you to make it perfect. That is the difference. So it is reproducible. I can adjust the line like 8.5 millimeter means 8.5 millimeter only. 0 degree means only 0 degree it will cut. That is the precision of this. Okay, these are the two of my boys, Saurabh and Amrit. They are the experts in robotic, and they are very fast surgeons. Yeah.
But requires surgeon skills also, right?
Yeah, of course.
Training.
Yeah.
Training is tough. Luckily in sports we don't have robots. Otherwise,
It is coming.
Yeah, but
It is coming.
playing, right? Playing only players
Yeah,
can do
players,
it.
yeah. Machine won't take over.
Now training it is going to come. There is a robot which plays basketball.
ಮೂಲಂಗಿ ಫೋಟೋ ಕೊಡಿ.
ಅವು ಓದ್ಬಂಡು ಅದು ವಾಯ್ಸ್ ತಿಕ್ಕು
Sorry.
ಸರ್ ಬಲ ಸರ್ ಬಲ माझी आप देखिए
miles, who walk a lonely path with courage and conviction. He reached for the stars, his feet firmly on the ground.
This man transformed an entire landscape. Ramdas Madhav Pai is a man on a mission. His single-minded devotion to a cause, empowering learners and nurturing lives, is a story that is a legend in itself. Taking over the foundation laid by his father, Dr. TMA Pai, he single-handedly created modern Manipal, a vibrant education township which became the launchpad for creating institutions of repute across the globe.
It was he who took over from his father. And remember, in 1978, we were not as large a university as we are now. But just think of the tremendous changes that have taken place in Manipal since 1978. It was all Ramdas's work.
If you think there are 1 billion mouths to feed, we are a poor country. Whichever, even American government will die. But if you think that 1 billion pairs of hands to work, we are a rich country. Provided you give this pair of hands some skill.
Dr. Pai's vision was it should be a deemed university, whatever designation we may give. It should be a university. University by definition is a universal
We
knowledge.
will continue with
So
the
we should
inauguration
have
ceremony
all
soon here.
faculties.
Our chief guest and dignitaries
This
are on
was
their
one
way shortly.
major objective of his.
When we got a deemed university, that is the period.
Good morning, ladies and gentlemen. A very warm welcome to each of you to this truly special and proud occasion at Kasturba Hospital Manipal, where we take yet another significant leap forward in redefining patient care through innovation, precision, and compassion. Today marks a historic moment as we gather for the inauguration of the Center of Excellence for Robotic Surgery, a milestone that symbolizes our hospital's unrelenting commitment to embracing technology that heals with greater precision and less pain. To commence the event, I would like to extend a warm invitation to our esteemed dignitaries and guests to join us on the dais. I request Mr. Sagir Siddiqui, Regional Chief Operating Officer, Manipal Hospitals, Dr. Sudhakar Kantipudi, Chief Operating Officer, Manipal Cluster, and Dr. Avinash Shetty, Medical Superintendent, Kasturba Hospital, to kindly escort our distinguished guests to the stage. We are truly honored to have among us today chief guest, the pride of our nation, Olympic medalist and badminton icon, Ms. Saina Nehwal. Dr. H.S. Balal, Pro-Chancellor, Mahe Manipal. Dr. Sharad K. Rao, Pro-Vice Chancellor, Health Sciences, Mahe Manipal. We acknowledge with heartfelt gratitude the presence of senior officials, faculty members, doctors, students, and dignitaries from Mahe and other reputed institutions who have gathered to witness this important milestone in our hospital's journey. We also take this moment to acknowledge the presence of Mrs. Usha Rani, mother of Ms. Saina Nehwal. Thank you, ma'am. The field of medicine is constantly evolving, and today we stand at the forefront of that evolution. The Center of Excellence for Robotic Surgery at Kasturba Hospital represents the perfect union of embracing technology and human compassion. Robotic-assisted surgery enables us surgeons to perform intricate procedures with unmatched precision, using smaller incisions and ensuring quicker recovery, minimal pain, and shorter hospital stays. This milestone is also a tribute to the visionary founder of this great institution, Dr. T.M.A. Pai, whose dream was to make world-class healthcare and education accessible to every individual right here in Manipal. His vision continues to guide and inspire us as we take this remarkable step forward in patient care and medical innovation. With this new initiative, Kasturba Hospital reaffirms its mission to make world-class healthcare accessible to all, combining technology with the timeless value of empathy and service. Let us begin this momentous occasion on an auspicious note by seeking the blessings of the Almighty. Please join us for the invocation.
गजवदना करुणा सदना गजवदना करुणा सदना शंकर बाला लंबोदर सुंदर गजवदना करुणा सदना जनमरेन्द्रनु मुनिवरु पणियुम जनमरेन्द्रनु मुनिवरु पणियुम पंकज चरण शरणं शरणं पंकज चरण शरणं शरणं गजवदना करुणा सदना गजवदना करुणा सदना शंकर बाला लंबोदर सुंदर गजवदना करुणा सदना आ
Thank you for that serene and uplifting start. A perfect way to begin a day filled with hope, healing, and progress. To officially welcome the gathering and share his thoughts on this transformative step forward, I invite Dr. Sudhakar Kantipudi, Chief Operating Officer, Manipal Cluster, to deliver the welcome address and offer us a brief note on robotic surgery at Kasturba Hospital.
Good morning, everybody. Today, it gives me an immense pleasure to extend a very warm welcome to all of you on this momentous occasion for the inauguration of a Center of Excellence for Robotics at Kasturba Hospital, Manipal. We are truly honored and delighted to have with us our chief guest, Ms. Saina Nehwal, Olympian, badminton legend, and recipient of Padma Bhushan, Padma Shri, and Arjuna Awards. Ma'am, we are really fortunate to have you today here. Your presence here today is an inspiration for all of us. You are a true personification of excellence, discipline, and perseverance, qualities that perfectly reflect the vision of our Manipal University. A warm welcome as well to our guest of honor, to Dr. Sharath K. Rao, Pro Vice Chancellor, Health Sciences, MAHE, whose guidance continues to strengthen our clinical and academic excellence. We welcome you, sir. We are deeply privileged to have this event presided over by our beloved Pro-Chancellor, MAHE, Dr. H.S. Balal, whose leadership and vision has been the cornerstone of our institution, enduring growth and reputation in education and healthcare. Thank you, sir, for gracing this occasion. My warm welcome to the Registrar of Manipal University, MAHE, Dr. Giridhar Kini, Mr. C.G. Muttana, Advisor, MAHE, Dr. Anand Venugopal, COO, MAHE, Mr. Sagir Siddiqui, Regional COO, Dr. Avinash Shetty, MS, Dr. Sharon Shetty, Deputy MS. I also take this opportunity to extend a warm, special welcome to all our respected heads of the institutions, university officials, heads of the departments, faculty members, and administrators across MAHE. Your presence adds immense value to this function. Today marks a historic milestone in the journey of Kasturba Hospital Manipal. The Center of Excellence for Robotics represents not just technological advancement, but a commitment to precision, safety, and patient care. With the state-of-the-art platforms like Hugo, Medtronic Robo, and Mako Striker, we are ushering in a new era of robotic-assisted surgery, one that enhances surgical accuracy, almost very less blood loss, and the ALOS dramatically comes down with this new technology. And obviously, it improves fantastic patient outcomes. This center will also serve as a training hub for all the surgeons and medical students, enabling them to gain hands-on experience on the next generation technology and preparing them for the future. At Manipal, we always believed in combining innovation with compassion.
Symbol of wisdom, purity, and progress. To make the official inauguration of the Center of Excellence for Robotic Surgery, may I invite our distinguished dignitaries to come forward for the lighting of the lamp. As the flame glows, it represents our collective commitment to illuminate the path of healing and innovation for generations to come. We now move to another area where robotic technology has created a remarkable impact: knee replacement surgery. Knees are the pillars of mobility, and restoring them with accuracy means restoring a person's freedom and quality of life. To share his insights on how robotic surgery ensures precision in implant placement, reduces recovery time, and improves patient satisfaction, I invite Dr. Sharad K. Rao, Pro Vice Chancellor Health Sciences, Mahe Manipal, to speak on robotics in total knee replacement surgery.
Thank you. And I think this is one of the rare occasions where I'm asked to speak on orthopedics rather than being an administrator and a Pro Vice Chancellor. Chief guest of today's function, Dr. Saina. And we call everybody doctor as long as they sit in this stage. Dr. Balal sir, Sudhakar Kantipudi, Siddiqui and Avinash, and all the esteemed guests who are here. We all know that aging is a process where your muscle mass, bone mass, including the brain volume, goes on coming down as we age. The same thing happens to the knee joint also. Knee joint is, after all, a joint for the smooth movement. There is a coverage of cartilage. As the aging advances, this cartilage, the smooth surface of the cartilage starts eroding. And that is where the pain starts. The bare bone surfaces exposed to each other. And this process is more in the weight-bearing joints, in the knee and in the hip. Slowly starts giving rise to pain in the knee, stiffness. Sometimes you might develop deformities, start limping, and day-to-day activities become difficult. There are plethora of treatment which are described for this, starting with lifestyle modification, support with a walking stick, medication, weight loss, regular exercises to strengthen the muscle, and intra-articular injections. But these are all not going to reverse the process which has occurred in the knee. They might slow down it a little bit or give a temporary relief for some time. But the ultimate surgery is the replacement, where the joint is being replaced with a metal and plastic, a special type of combination of metals or titanium, and a plastic which is a special type, again doesn't get eroded for long. So you can either do this conventionally or you can do it with a robot. In a conventional way everybody has been doing it. Later came navigation to help the surgeon to navigate it better, and the next step is robotic. Please remember that it is a robotic assisted surgery. It is not that the robot is going to do the surgery. Robot helps, magnifies the judgment of the surgeon, makes it so that your surgery is perfect. What has been pre-decided is executed. Now, what is this pre-decided? You plan the surgery at least a day before. CT scan of the knee is taken, and that CT with the 3D image is fed into the computer, and the surgery is planned. Surgery is planned in a way that how you want the alignment to be done, what is the best alignment you can produce with the deformities, what is the thickness of the bone you are going to remove tomorrow, what is the size of the prosthesis which you are going to use it. All these are pre-planned. Now, when you are doing surgery, you open the knee joint. Now you have to correlate between the CT scan which is there inside the computer and the knee which you have opened. They must synchronize. That is called mapping. You use the camera and use the signals and map the area so that it correlates that area to the CT scan. And once that correlation is done, You have already selected the type of processes, the thickness of bone you have to cut. Now that arm, robotic arm, which has got the saw, now you have to operate that arm. When you operate that arm, if you place it in the right place to take 8 millimeter thickness, then only the saw will start. If there is a degree up or degree down angle, or if there is a little bit of up and down as far as the millimeter is concerned, saw doesn't work. So saw will dictate you to hold it in a correct position, so that if you want to cut 7.5 millimeter, you will cut exactly 7.5 millimeter. If you are cutting at a 90-degree slope, you will cut 90 degree only. You will not deviate a single degree when you use this robotic arm. And that is the precision. So what is the advantage? Advantage is you will have a knee which is perfect, which is pre-planned, and it is knee specific. So it is not one size fits all. You have decided that this man needs this type of knee. And the amount of bone loss is very less. You preserve a lot of bone. So why does this precision help? The knee will accept it. The person will accept it better because it's more natural. It will last longer because it is very perfectly placed and precisely placed. So can we do it in all patients? You have to be very restrictive. In the sense, a robotic knee surgery takes at least 1.5 to 2 times the amount of time under anesthesia. So conventional surgery, if somebody can finish it in 35 to 40 minutes, this will take 1 hour 45 minutes to 2 hours. So you should see whether the patient can take up the anesthesia of that amount. Whether it is good in a patient who is 75 years old, has got diabetes, hypertension, heart problems, whether it is good to make him undergo an anesthesia for a period of 2 to 2.5 hours. That decision, that judgment has to come from the surgeon. So to put it in one single line, I will say that young patient, not many comorbidities, going to live for next 25 to 30 years without any problem is an ideal candidate for total knee replacement, which is robotic assisted. Thank you very much. Thanks for hearing.
Thank you, sir, for that enlightening presentation on how robotic innovations are giving patients a new lease on mobility and confidence. The journey of robotics in surgery has touched many specialties, and one of the most impactful areas has been in the care of cancer. To tell us more about how robotic-assisted surgery is enhancing precision, reducing complications, and transforming the way we treat patients with cancer, I invite Dr. Naveen Kumar, Professor and Head, Department of Surgical Oncology, KMC and KH Mahe Manipal, to share an overview of robotics in cancer surgery.
Respected dignitaries on and off the dais, and respected senior faculties, dear hospital staffs and students, and all administrative people and press media. So very good morning to everyone. It gives me immense pleasure to give brief overview about robotics in cancer surgery. As all you know that treatment of cancer has evolved over decades, maybe 2 to 3 decades. It has been evolving very fast. And minimal invasive surgery, it is the integral part of our cancer surgery. Minimal invasive surgery, it is what you call as the keyhole surgery. It has become integral part of our cancer surgical management from last 2 decades. So MIS or minimal invasive has started with laparoscopy. It is used for keyhole surgery for tummy. Thoracoscopy surgery, it's been used for a thorax to address the chest tumor or inside the thoracic cavity tumors. So it's become integral part since last 2 decades in thoracic in terms of lung cancer surgeries, thymectomies or thymus tumors, mediastinal tumors. In terms of abdomen, it could be from the gastrointestinal tract surgeries, hepatobiliary pancreatic surgeries, and gynecological surgeries are one of the most commonest area where it's become standard. It was the one of the subsite just become standardized as early as in 20 years back, and the urological cancer surgeries. Robotic surgery was introduced maybe a decade, maybe more than 15 years in India, maybe in the, when I was trained, it is like 2013, it was first introduced in Tata Memorial, other than other centers. And see, any new things to come to the application or to come to the applicability of the patient, we need evidence. We can't just start the new technology or just start operating. So over these 10 years, I think there's a lot of evidence have started, a lot of randomized trials have given enough evidence to say that robotic surgery is become safe in cancer surgery, particularly in the thoracic, gastrointestinal tract, and gynec and urological cancers. Robotic cancer surgery is gaining popularity. Why it is? I think already many of have spoken. It might be because of the surgeon, maybe a patient perspective, already sir has spoken. It is the smaller incision, the pain, and the less blood loss, and obviously the less chance of infection, quicker to go back to the routine activity. But the surgeon perspective also, it is important in terms of the robotic surgery. What we have discussed, like the surgeon, it provides the higher precision and the magnified view. It is the most important thing, particularly we work in a narrow space or a narrow pelvis or somewhere in the working in the nerves area where we want to preserve the functions, we want to preserve the organs. I think the robotic comes the first, and it comes the handy in those areas without compromising the cancer surgical care. So same thing about other factors which are benefiting from the robotic surgery is like age. Like aged patients are much getting benefit from the robotic surgery because of his early recovery. And also in the cancer patient, particularly the patient who require adjuvant chemotherapy, like post-surgical treatment, like radiation chemotherapy, because of the early recovery, we are able to start maybe early or on time with this treatment because of this minimal invasive or robotic surgery. Based on the subsite, this robotic surgery in the cancer surgery can be used for a multiple area. It is like our sir has said, it's about the knee or hip. In the surgical oncology or cancer surgery, there is vast applicability of the robotic surgery. It's from the top to bottom. Maybe list, it might be the thoracic surgery. I already mentioned the lung cancers. Where it comes in handy is like a thoracic, where you want to save the lung. Maybe what you call in a scientific term, it's the segmentectomy, or what we call is to save or remove the only part of the trachea or only part of the bronchus. It comes very handy with other than open and laparoscopy or thoracoscopy surgery. And other than I already mentioned, thymectomies are the most common area what we are going to remove in the thoracic and the mediastinal tumors. In other subsite like gastrointestinal cancers, it starts from the top. It is the esophageal cancers, one of the area what we routinely use. It is the food pipe cancers. Then comes the stomach and colon and large intestine cancers, colon and rectum comes. And hepatopancreaticobiliary, it is like a cancer of the pancreas and liver resections can be performed with the robotics. And next comes the gynec and urological. Gynec may be the endometrium. Endometrium is the one of these, and we got a first evidence or randomized trial to say that it's like a robotic surgery is very safe in almost like a 15 years back. Because the recovery is so fast that in the gynec cancers, the patient goes home in a second day or first day, depending on whatever the recovery obtains. And urological cancers, obviously it is the prostate cancers, bladder and kidney cancers also. So robotic helps, as already I mentioned, function. Like functional and organ preservation, it comes in handy. And one of the area is what we do in a scientific term is the intersphincteric resections, like a very low cancers where patient require a stoma. Maybe robotic will help in avoiding this stoma, and by doing the intersphincteric resection, as robo can reach to as we want, as narrow we want. That is the one advantage we get it from this robo. And as I already mentioned, bronchial or tracheal tumors, without removing the lung, we just remove the part of the cancer involved, and again we stitch back an anastomosis so that we can preserve the complete lung. Or in the kidney cancers where
we just remove the tumor, what we call as a partial nephrectomy, where just remove the tumor and it will be more easy to replicate compared to the laparoscopic and open surgery. So with this background, I am happy to say that Department of Surgical Oncology, with this Hugo system, we have already completed 25 major cancer surgery in the KMC. I am happy to say that. With that, we have completed already like 12 colorectal cancers, 5 esophagectomy or food pipe cancers, and 6 gynecological cancers. And recently, last week, we have performed with this system, it is the India's first lung resection. The left lower lobectomy was performed by using Hugo system. Because anything too new, even company also doesn't have any standard practice or standard port placement. We have to sit, we have to discuss which is the best with the port position, because everything is standardized with the company, it will be easy because we just need to replicate. But when there's no platform how to do it, then we have to discuss and plan. I think I am happy to say that this is the Hugo's first lung resection. The thoracic surgery happened in the KMC last week. So all these 25 cases what we performed, all 24 cases have discharged without any comorbidity. Our average stay, our length of stay was gynecological cancer was 2 to 3 days, and colorectal cancers was 4 to 5 days, and esophagus 7 days. Usually esophagus cancer takes up to 10 to 12 days. That's how the recovery is. Like the age of the cancer, what is the extreme age what we operated recently was the 76. He has recovered and went home well. So I use this opportunity to thank the hospital management, cancer block coordinators, and my colleagues and resident anesthesia team, nursing team, and obviously Hugo team to their continued support to achieve this. And lot of appreciation for anesthesia and nursing team particularly, and of course my colleagues and resident, because it is not easy to introduce a new system where there is no guide or no proctor. Again, I want to stress that we are the first team, I think, in the KMC. We have not used any proctor because there are no proctor in the cancer surgery. We only standardizing our tech. I am happy to say that our surgical team was the first team to going to standardize. In future also going to standardize many procedure using the this Hugo system. So I am sure that KMC will become center of excellence, as we have already mentioned, for robotics with active participation of all the other department. And I am very confident that Department of Surgical Oncology will become the referral center with addition of this robotics. Thank you for patient listening, and Jai Hind.
Thank you, sir, for that comprehensive and enlightening talk that truly highlighted the life-changing potential of robotic technology in oncosurgery. Now, the moment we have all been eagerly waiting for. We are deeply honored to have with us a name that resonates with excellence, perseverance, and national pride. Our chief guest, Ms. Saina Nehwal. She has inspired millions across the country with her sheer grit, discipline, and determination, qualities that perfectly reflect the spirit of innovation and excellence that this new center embodies. In the world of sports, where every movement and recovery matters, modern medical technology and advanced surgical systems like robotics play a vital role in helping athletes regain strength, recover faster, and return to their game with renewed confidence. Ladies and gentlemen, please join me in giving a warm welcome and round of applause as we invite Ms. Saina Nehwal to address the gathering.
Respected dignitaries on the dais and everyone here, very good morning. First of all, this is my first time coming to Manipal, and I found the campus really beautiful, really nice. And in fact, my physio, I was with him from last 20 years. He's also come out of Manipal University. His name is Kiran Chalagundla. So he used to keep telling me what a beautiful university, you should go and visit and go there, have a look. And today, I think it was destined in some way that I had to be here. I saw the campus really nice, saw the sports facilities. I still have to go there, but I briefly saw it, and it's, I think, really, really nice. You know, as sports person, we face a lot of injuries. We hate injuries, but that's what we like, you know, coming out of it and becoming champion again, winning again. That's the attitude a sports person, obviously at the highest level, is got. Everyone is mad for winning, so they don't mind coming out of surgeries or any kind of injuries and waiting for their time to, you know, when they get fully fit again and start playing again. So definitely the trainers, physios and doctors play a huge role in our recoveries and getting us back into very good shape. And today when I saw this equipment, robotic equipment, which is really, really nice for the recovery, and when Sudhakar sir was telling me that in the morning he was giving me an example that they got, I think, 89-year-old patient done the surgery with, and he was okay the next day and he was able to walk. I think this is really, really nice, which even the sports persons look forward to. We have to obviously go through that process of getting our muscles back to that stage where we can play at that level, but it will be really great, sir, if we can walk the next day and go back to our houses and start rehab and, you know, getting back to the court fast. But yeah, after the surgeries, it takes us almost like we are in the plaster for like 4 or 5 weeks, and then rehab and then coming back. So obviously it's a process, it's a tough process. You have to be mentally strong. But I think this new innovation is really going to help a lot of athletes, a lot of normal people out there. But personally, as a sports person, I think I would want to stay away from the surgery as much as possible, because it's always nice to go to the physio and do good exercises and be ready for the tough time. Of course, you won't have the issues till 40, 45, but after that, I can see my parents both, they played badminton for like 25 years, and they both are having some issues in the neck, back, knees, ankles, and they keep telling me, Saina, kya kare? Hospital mein, they are scared to go to the hospital. My father is like, oh, almost I can't breathe. So he gets scared to go to the hospital. So I tell them to go to the physio, and they come back with some good exercises, and they feel better. So I can only say, keep doing good exercises so that body is active, and keep lifting heavy weights, which is very required, I think, nowadays. People think that 1-2 kilo mein ho jayega, thoda bicep curl kar lenge, thoda triceps kar lenge. I think this is not the way you have to go. You should pick up heavy weights to keep your muscles stronger. Whether you're 60, 70, it doesn't matter. You have to pick up heavy weights to keep your muscles stronger and to take care of your body. Otherwise, surgeries तो चलते रहेंगे. We have the best medical system, लेकिन जो pain होता है वो फिर से 10 दिन में आ जाता है. And I have seen that with my a couple of friends' father. You know, they went through this surgery. वो cartilage चले जाता है. Even for players, you know, we had to stop playing. I had to stop playing because my cartilage was completely gone. It's, I think, called arthritis, where you try to start again, and the knee gives you big swelling, so you can't push more than 2 hours. But if you want to play at the highest level, you have to push for almost 10 hours. So I couldn't push anymore. In fact, our doctor, Mr. Dinsha Padiwala, who's in Mumbai, he's, all the sports persons love him, and he's like, अगर आपका knee टूट जाता तो मैं उसको ठीक कर देता, but I think this I can't do much, and you will not be happy if I even do surgery for this, because this is not going to end. You know, you will get the problem again and again. So with heavy heart, I had to stop playing. But I can only say for the new generation who's coming up, they have all the information on social media. They have the best trainers, physios. This is for the sports persons, of course, because they have a motivation, and they have some kind of a goal to look up to achieve something, so that they can push their bodies. But I can only request the normal people out there who are busy 24/7 with the jobs, that find some time to keep yourself active and fit, so that you know, you're healthy throughout the life. But otherwise, I'm so proud that India is so ahead in medical system, that we have reached a level where we can actually take the help from the robots, and of course it must be there at the international level as well. But we are progressing really, really well, and that's what shows that we are so good in everything. And now I just hope we get this Olympics thing in 2036, and we also become a sporting nation in the future. So thank you once again, Manipal University, for having me here and showing me such fantastic campus, and looking forward to the sports arena soon. Thank you. Thank you.
Thank you, Ms. Saina Nehwal, for your gracious words and adding your presence and inspiration to this milestone event. As a token of our appreciation and respect, we now will felicitate our chief guest, Ms. Saina Nehwal, for gracing this momentous inauguration of the Center of Excellence for Robotic Surgery. May I request Mr. Sagir Siddiqui, Dr. H.S. Balal, Pro-Chancellor Mahe, and our other distinguished dignitaries on the dais to kindly join in the felicitation of our chief guest. Thank you, esteemed dignitaries, and thank you, Ms. Saina Nehwal, for being part of this proud and historic day for Kasturba Hospital. To share his thoughts and vision for the future of healthcare, and to speak about how initiatives like this are shaping Mahe's legacy of medical excellence, I now invite Dr. H.S. Balal, Pro-Chancellor Mahe Manipal, to deliver the presidential address.
Our chief guest of this afternoon, legend of shuttle badminton, Saina Nehwal, her mother Usha Rani. आपकी वजह से साइना नेहवाल इधर है ना? Welcome to you, ma'am. Then senior dignitaries of the university, faculty members, and my dear students, and members of the press and electronic media. Very, very important. Because when Sudhakar Kantipudi was welcoming, somebody came and whispered, saying that you have missed press people. Press people are very important for us, not from the point of view of projecting us. But it's important that here hardly you see 300 or 400 people. More people should know about this event and also about this state-of-the-art facility, robotic facility, center of excellence that we are having today, which is for the benefit of the poor patients. All the patients for that matter. And that press people only can do that. So my dear friends from the press and electronic media, I am very happy to be part of this Center of Excellence robotic inauguration of Kasturba Medical College or Kasturba General Hospital. I should compliment Sudhakar Kantipudi for organizing this event and getting a very important person, relevant sports person of great repute, Saina Nehwal, to this program. Now this robotic, the excellence, the details of all that, Sharat Rao, an orthopedic surgeon of great repute, and also Kiran Acharya is here, the head of the department of orthopedic. Nilla, Bera Nodlin is here because we have visited the site of these facilities, orthopedic facilities, and Kiran Acharya and Sharat explained to Sania about the facilities, how the robot is helpful in improving the facility of orthopedic surgery, which is very important for Sania because they invariably sustain these ligament tear, cartilage tear, etc., which she has already mentioned. And then cancer facilities, Naveen Kumar has already explained to you the facility, and also Prasad, our head of the department. Prasad, just rise, man, so that others can see you. In surgery, how useful it is in helping the patient with minimal invasion. That is very important, and also recovery is very fast. That's the reason why we have. And Kasturba Medical College, Sania, is, as Sharat Rao told you in the presentation, 29th first self-financing private medical college to be started in this country in 1953. And ours was the 29th medical college. Today, we have more than 700 medical colleges in this country. I'm happy and proud to say that we are consistently ranked within the top 10. I always say reaching the top is difficult, but to remain in that position is still more difficult, which we are able to hold on. Basically, we feel it is because of the quality of the faculty and the students. Because in Manipal, there is no other criteria for admission of the students or selection of the faculty other than merit. Merit, and merit only, because we strongly feel the quality of the students and faculty are responsible for the quality of the institution or reputation of the institution, rather than the infrastructure, bricks and mortars. It is necessary, but more important than that is the quality of the faculty. That's why we call Kasturba Medical College as the flagship of our university. We have 25 institutions. We are a multidisciplinary university, of which KMC, we call it as the flagship, and we in the university consider it as a precious jewel in the crown of Mahi. And I'm very proud, and I should congratulate you. And we in Manipal, we do not compromise in the quality of either providing education or healthcare. Now, these are all state-of-the-art facilities. Healthcare facilities very expensive today. And majority of our people in this country are poor, below poverty line. Unless these newer technologies reach the poorest of the poor, it doesn't make any sense to have these newer technologies at all. We have a policy in Manipal that no patient is denied of treatment because he or she doesn't have money. Similarly, no student, meritorious student, is denied of education because he or she doesn't have money. Because we have scholarships, we have poor patients fund, and we see that the patient gets the best of the best quality treatment, including this robotic facility. See, then only it makes sense. So I'm very happy that Kasturba Medical College, being the leader of one of our institutions of our university, is taking an active role and are living up to their reputation. I should compliment both the cancer people, Naveen Kumar, his team, Prasad and his team, as well as Kiran Acharya and his team, for getting the state-of-the-art facility, which is very important. Minimum invasive surgery, patient can go back fast, doesn't have to stay in the hospital for long, because the more they stay in the hospital, the cost of treatment goes up. So that is the important, and also, as I said earlier, it should reach the poorest of the poor. So with this, I congratulate the Kasturba Medical College. The dean is on leave, I am given to understand. But the orthopedic department, as well as the onco and the general surgery department, for getting this facility, make the best use of it and see that the poorest of the poor also get the benefit of this. With these few words, I thank the organizers for giving me this opportunity to be part of this very important program, where a legend is the chief guest, and our mother also is here with us. Thank you very much for the opportunity. Wish you all the best. God bless.
Thank you, sir, for your inspiring words and for your continued guidance that constantly encourages us to push boundaries and pursue excellence in all that we do. Every successful event is the result of teamwork, planning, and support from many individuals. To express our heartfelt gratitude to everyone who contributed to making this day possible, I now invite Dr. Avinash Shetty, Medical Superintendent, Kasturba Hospital Manipal, to deliver the vote of thanks.
Chief guest of the day, Mrs. Saina Nehwal, all the respected guests on the stage, off the stage, invitees, print and electronic media, and ladies and gentlemen, good afternoon to everyone. It's my privilege and honor to deliver the vote of thanks on this very special, memorable day, the inauguration of Center of Excellence for Robotic Surgery at Kasturba Hospital Manipal. On the behalf of Kasturba Hospital and Manipal Academy of Higher Education, I extend our heartfelt gratitude to our chief guest, one of the greatest sporting icons of our country, Olympian Mrs. Saina Nehwal, for gracing this occasion with her inspiring presence and words. Thank you very much, madam. It was really great pleasure and honor to have you with us today for this momentous occasion. And we also sincerely hope that your presence here would inspire many of our young sports personnel of this beautiful coastal region to take up badminton. I was just telling her, long back we celebrated our own Prakash Padukone when he won the World Cup in 1981, way back in 1921 in Malaysia. But after that, we didn't have many sports icons in badminton, but it was Saina Nehwal, I think, after Prakash Padukone, who came on stage and inspired a lot of things. And today we have our own Chirag Shetty and Ayush Shetty from this region who are doing excellent achievement in the sports of badminton. So thank you once again. And thank Mrs. Usha Rani, बहुत शुक्रिया आपको यहाँ आने के लिए. And I also express our sincere thanks to Dr. H.S. Ballal, Pro-Chancellor Mahe Manipal, for his continued leadership, support, and always motivating us to achieve higher in our pursuit of excellence. Thank you, sir. Our special thanks to Dr. Sharad K. Rao, Pro-Vice Chancellor, Health Sciences Mahe, for his insights about robotic technology in revolutionizing surgery and patient care. Thank you, sir. I also like to express my sincere thanks to Dr. Giridhar Kini, our Registrar of Manipal Academy of Higher Education, for gracing the occasion. A heartfelt thanks to Mr. Sagi Siddiqui, Regional Chief Operating Officer of Manipal Hospitals, and Dr. Sudhakar Kantupudi, Chief Operating Officer of Manipal Cluster, for his constant guidance and support, and also making this happen this day today. I also equally grateful to Dr. Naveen Kumar and Dr. Prasad, Dr. Kiran Acharya, and Dr. Arun Chawla for their presence and as well as briefing on the robotic surgery. Thanks to Dr. Abhinita for the invocation. And I thank all our faculty members, doctors, nurses, students, all the staff who worked tirelessly to bring this dream to life. A big thanks to press and media, both print and electronic, for gracing this occasion, large numbers, and always being supporting us. Thank you very much. Ella Madhyam Mitrarigu Dhanyavadagalu. Once again, in one words, I would like to thank each and everyone. A program of this nature would not happen without a teamwork. And I want to make a special mention of Mr. Sachin Karant and our entire marketing team of Kasturba Hospital, who tirelessly worked behind the scenes to make this program successful. Thank you, each and everyone, ladies and gentlemen. Have a great day. Thank you.
Thank you, sir, for your words of gratitude. As we come to the close of this wonderful event, we do so with pride and gratitude. The Center of Excellence for Robotic Surgery at Kasturba Hospital stands as a symbol of our commitment to innovation, precision, and compassionate care. We invite you all to join us for high tea that is arranged outside the venue. For the members of our press and media, we request you to please proceed to the boardroom on the second floor of this building, where a short interaction has been arranged with our experts to share more about the clinical and technological advancements that make the Center of Excellence for Robotic Surgery a true milestone. We also welcome any questions for our chief guest, Ms. Saina Nehwal, regarding her views on sports recovery and how modern medical technologies like robotic surgery can support and help our athletes in regaining peak performance. On behalf of Kasturba Hospital and Mahe, I thank each and every one of you for your presence and support, making this day memorable. Thank you and have a pleasant afternoon ahead.